Right. So if you've read and understood, considering its surgical anatomy station, please tell me, after you've read the stem, what are the provisional diagnoses that you'll consider or keep in your mind?
The femoral hernia is my provisional,
And what
but
differential diagnosis would you consider?
Safena varix
Yes.
or inguinal hernia.
Okay. And okay, we'll come back to that later. Right. Okay. If you could look at here in the image and identify the structures from A to F, can you please?
Yes, A is sartorius,
Right. B.
B is genitofemoral uh, nerve, and D is sorry, E is
Okay. Please tell me how the femoral triangle is formed.
superiorly there is
Okay.
inguinal ligament.
Yes.
Laterally there is sartorius, and
All
medially
right.
there is vector longus, and floor is formed by the pectineus and iliopsoas.
Tell me the floor of the femoral triangle from medial to lateral.
From medial to lateral, it's adductor longus, then iliopsoas, and then pectineus.
Adductor longus, iliacus, and then pectineus
Pectineus.
is first. Pectineus is the medial most. Pectineus, then adductor longus, then iliacus, and the most lateral is psoas. Right. Okay. And what are the contents of the femoral triangle?
Most medially is vein, and
Most medially is not vein.
inguinal lymph
Okay.
nodes. Lymph
Okay.
nodes,
The femoral canal.
yes, and then a vein, then
Yes.
artery, and then nerve.
Yes. Femoral nerve. Right. So, what are the contents of the femoral canal?
Femoral canal has vast in male and
No, it
round.
has fat and it has the lymph node of Cloquet. Femoral canal, I asked you.
Yes, it has yes lymph node of clockwise. Yes.
And the fat. Okay, there is one physiological significance and one pathological condition related with the femoral canal. Can you please tell me?
Physiological, pathological is femoral hernia,
Yes?
and physiological is saphenous varix. Am I
No,
right? I'm
no,
guessing.
no, you don't guess. Because it serves as an empty space. So whenever there is increase in venous return, so what happens is this intra-abdominal pressure increases as means of Valsalva maneuver. So this provides us a temporary or the place to fill in during that time, temporarily
Okay.
for the stasis of the venous flow. All right. Please tell me how the femoral sheath is formed.
Femoral sheath is formed by the continuation of fascia lata and the external
No,
oblique aponeurosis.
no. You, it's transversalis fascia anteriorly, which fascia over iliacus posteriorly. So these are the two ones which get together to form. Okay, please tell me if you can identify this structure here.
This is inguinal ligament.
Yes, please tell me the attachment of the inguinal ligament.
It originates from the anterior superior iliac spine,
Yes,
inserts on the pubic tubercle.
right. Okay, we are moving on. If you could please look at the image on the left-hand side and identify number one. If you could tell me what structure is this pointing at?
This is adductor magnus. One.
Okay, please tell me the origin and insertion of this structure.
adductor magnus is inserted on the anterior aspect of femur, and it is originated from the ischial lateral border of the ischial tuberosity.
Okay. One more thing very closely, if you could tell me here, if you could see something popping out, what could that be? If you can identify that. This is, by the way, adductor brevis.
Okay.
Yes. Okay. If you could identify this vessel.
This is superficial femoral artery coming
Yes.
out from the adductor canal.
Yes, very good. Please tell me the boundaries of adductor canal.
Adductor canal laterally, there is medially there is sartorius, and laterally there is adductor longus, and superficially there is fascia and skin.
Okay. What are the contents of Hunter's canal?
Saphenous superficial femoral artery, superficial femoral vein, and saphenous nerve.
How many compartments there are in the thigh?
There are three compartments: anterior, medial, and posterior.
Would you be able to tell me what are the muscles which are classified in the anterior compartment?
There are four muscles: quadriceps, biceps femoris, vastus pedialis, vastus lateralis, vastus intermedius.
What is the nerve of the anterior compartment?
It's the femoral nerve.
Okay, right. If you could identify, okay, you could see thigh has been cross-sectioned into three parts, first, second, and third. Would you be able to identify the muscles or the structures labeled in upper and the middle cross-section? If you could
Yes.
try, yes, I tell you, this is sartorius crossing here. You identified it correctly in the previous image, and you could identify it here as well. See, they are parallel to each other, so you'll be able to identify. This is sartorius. Which muscle could that be? And this is, remember, the lateral side of the thigh. It does not have to be a muscle, but it's a structure. So this is a hint.
Okay, this is tensor.
Very
tensor,
good. You say it?
Tensor fascial artery.
Very good, exactly. And number 3 over here, you just identified it. You just told me. What could that
Yes,
be?
it's vastus lateralis.
Very good, excellent. And number 4 is here. It's also one of the interior ones.
Yes, it must be.
No, actually, it's not anterior. It's on the back. It's the posterior
Yes,
compartment muscle. So,
uh,
and it has two, look very closely. Answer is in front of you. It has two heads, two origins.
yes, it's biceps femoris.
Biceps. Yes, very good. So its anatomy is as easy. If you know it, you can identify it. Number 5, we are moving here. Now, this is the medial aspect.
Yes.
Big muscle. Here, it was brevis, and this is magnus.
Magnus, adductor magnus.
Yes. And this is 6. Very
This
easy, medial, and it's called also the muscle of virginity.
Gracilis.
Gracilis. Very good. Now, moving on. Sorry, 7. Another
7 is
back
semi.
posterior side semi-tendinous.
Remember, semi-tendinous.
And
Also.
8 is also the same as 6. Gracilis. Good.
Gracilis.
Very good. And one more question I had to ask you. Bell is gone, but I was thinking if I could ask you. Okay. Or is that enough?
Yes, ma'am. Thank you.
Okay. Yes, there are this terminology is vascular lacunae. If you could tell me what do you understand by those?
Vascular reticuli are the blood vessels supplied to the femoral head, and they are the
Wait,
ascending cervical
there are vascular
extra.
lacunae and muscular lacunae. There are two, medial and lateral.
Yes,
Yes,
this
behind
is
and
what
below the inguinal ligament. So yes, what are these?
these are branches of the profunda femoral artery,
Yes, yes,
which supplies the head of the femur, and ligamentum teres artery, which is branch of the obturator artery, also supplies the head of the femur.
okay. Right. So there are two, vascular and muscular. So all right, good. Thank
I
you.
think, Mom,
He's telling me, yeah.
vascular. This one is a part of the femoral
Femoral
sheath.
triangle, yes.
Yeah, it is vascular lacunae containing femoral vein and femoral artery. Muscular is the muscular. It's containing. I think it's iliopsoas tendon.
Yes.
And the other muscle, I don't know. It's when they ask you about the femoral sheath, it's formed from two.
Iliosoas, iliacus
Yeah,
and
yeah.
psoas, iliosoas.
Iliopsoas, yes.
Yes.
Muscular lacunae.
Muscular
Yes.
lacunae, and that is lateral, but the vascular one is more medial, so it's below and behind the inguinal ligament. So it's the lymph node most deep, then the femoral vein, artery, and femoral branch of the genitofemoral nerve. Good. Thank you.